Hi, welcome back to our monthly video blog. It's Ellen and
I'm Dr. Parker.
Thank you for joining us again. This month we are going to talk about parvo. You hear about it all the time in the news and you hear it if you come into the clinic, but a lot of people don't understand what it is. So we're going to start off for Dr. Parker. What is parvo?
So parvovirus is a virus that younger dogs can pick up from the environment, and its main action is actually going into the intestines and causing basically, the intestines to kind of, break down the lining of the wall and start having, effects on the GI tract.
Okay, what are the symptoms of parvo?
So when you think of GI tract, the main symptoms you're going to be seeing is lots of vomiting and diarrhea. These are usually your main, signs that you're going to see as a puppy. The next thing is they're going to be really lethargic, basically kind of not acting crazy hyper self, kind of dehydrated. But the big two signs is your vomiting and diarrhea.
And it smells kind of different,
Horrible.
right?
It smells horrible. We can always can tell the smell of parvo. Yep.
How long is it contagious for?
So once a puppy actually is exposed to parvovirus, they can shed the virus up to almost 2 weeks in their feces, and that's when they're most contagious. We still like to say, even after treatment and supportive care, we still have err on the side of caution that your puppy can still be, potentially contagious to other dogs, about a month or so. But in the environment itself, parvovirus can actually live in the environment for up to 7 months to possibly longer. So it's very, able to survive in that environment pretty well. So it's very resistant virus.
How does the animal actually contract it then?
So most commonly, a way of contraction is from other poop from infected animals. So it's called fecal oral. So if your puppy's exposed to affected feces, either by litter mates or other dogs that are affected.
So they step in it, lick
Sniff
their
it,
paws.
lick it, yeah.
Okay. And then what is the treatment for parvo?
So there is no cure for parvo. So most of it is a lot of supportive care. Fluid therapy is the most best thing you should do for your dog because they're losing a lot of fluids, either vomiting or diarrhea. So replenishing the fluid loss is the most important. We also do a lot of GI protectants, antacids and some antibiotics as well to protect the GI tract, and just a low-fat diet to help with easy digestion.
Okay, the cost of treating the disease?
So it can be very expensive because your pet requires 24-hour care, and we do like to have them on IV fluids for 24 hours and possibly longer. And it depends on how well the dog responds to treatment, depending on how much it will cost. At home, basically what we quote is between $1,600 to $2,100, depending on how long the dog is here. And we have also seen higher.
Yeah.
20.
Like 28, 29.
Oh, 29. Okay.
Yeah, it can get bad.
So depending on what happens, we've had a few cases where dogs actually end up with more issues in the GI tract, where their intestines actually will engulf on themselves, called intussusception. We see other problems that can arise on top of just having parvovirus.
Ew. So it's pretty nasty.
Yeah.
Is it terminal?
It can be. Sometimes we like to quote, depending on when the dog comes in and how well they respond to supportive care. If they're not doing too well, we usually give a 50-50, survival rate for some of these dogs.
And then how can I prevent my pet from getting parvo?
So big thing is vaccinate. Vaccines. We start vaccinating puppies at 6 weeks old with just the parvo vaccine virus. It's safe. It's been used a lot out here, and it really helps prevent this. And then you come back in 2 weeks later for your first set of the distemper parvo combo vaccine, and you do another 3 rounds of that. And so, it's really big out here, and I really say, once you get a puppy, please make sure your vaccines are up to date.
And that's it. Anything else about parvo?
No, just be safe and get your dogs vaccinated.
All right. We'll see you next month.
Thank you.
Thanks.